protein markers on their surface as embryonic cells. Zengers. One wouldn't expect the immune system to recognize a cancer cell because itself. Dr. Lanka. That's it. We have a lot of embryonic cells in our body all over. Those are the stem cells. When the nerve cells have got broken, new nerve cells may regenerate out of the embryonic cells, because those cells cannot be regenerated. So we have embryonic tissues everywhere, and here comes evolutionary biology. Now I have to tell you the basis of our lives. The fermentation process was not producing enough energy to form multicellular organisms, or to enable the cell to differentiate. Bacterial cells are not differentiated, not able to build multicellular organisms, because they don't have enough energy. Only the invention of photosynthesis, using the energy of the sun to split down matter, in order to get electrons, allowed life to go on. Life is driven by the force of electrons, and with photosynthesis the electrons came out of the splitting of the water, and the base product was oxygen. This photosynthesis was so successful that it polluted the whole planet. The water, and eventually the atmosphere, became saturated with oxygen. Only when bacteria began to learn to use oxygen to produce much more energy out of organic material, out of a sugar molecule, did we have the next step in evolution. Life dealt with the oxygen catastrophe, and since then we have had a perfect equilibrium of oxygen-producing bacteria and oxygen-using bacteria, so that they keep the atmosphere at a constant level of 20% oxygen. This is exactly the level at which life is able to persist. At a lower level or a higher level, it is impossible. We are living in the equilibrium. That's the principle of Gaia, by the way. Those bacteria which learn to use oxygen were able to produce 20 to 30 times more energy per sugar molecule, because the oxygen at the end was sucking so many electrons, that many more electrons could be taken out of the sugar, to produce much more energy than was possible without the potent oxidative substance at the end of the energy-producing chain. This revolution in energy formation was the basis for all higher cells and all higher organisms. Of course, with this excess of energy, cells could eventually differentiate and form multicellular organisms. And these bacteria, which sear using the oxygen, are part of every one of our cells, called mitochondria. So very higher cell is a product of the fusion of several different kinds of bacteria. The spirochetes, which brought mobility into life, and the mitochondria, which produced much more energy than before. This excess energy is the basis of all higher life, and if you violate it, if you don't let the oxygen come into the organism, if the blood is oxidized by Popper's nitrites or sulfonamides including sulfa drugs like Bactrim and Septra, or if the transit way between the blood and the cells is poisoned by heavy metals, or the lack of essential fatty acids, or when the mitochondria are destroyed in the cells, due to the lack of nutrition, or antibiotics, the oxygen cannot be transported from the blood to the cells. Then the cell is not able to produce enough energy. It either may die resulting in inflammation, or when it's possible for a cell to survive, it will become cancerous when the cell is producing only fermentation. Then that's cancer, as Otto Warburg already detected in the 1940s. They knew from the very beginning that cancer cells have only embryonic markers on their surface. From a biological, evolutionary point of view, it makes sense that a cancer cell is a reduction to an embryonic stage. It differentiates due to the lack of energy, and it waits until the lack of energy is over in order to differentiate again. Of course, if the lack of energy persists, it loses genetic material. And these were the old criteria to define cancer, when cells lost a lot of genetic material, because then they lost the ability to differentiate again. Zengers. In other words, cancer occurs when the cell is programmed to behave like a cell very early in fetal development, and just divide like crazy. Dr. Lanka. That's it. An embryonic cell goes into a unicellular state. It behaves like a unicellular organism, like a bacterium. It loses the ability to stop replication when coming into contact with other cells. So knowing about evolutionary biology, you are able to explain everything. In order to explain failure to find a retrovirus that directly caused cancer, they claim to be able to measure the immune system. But this is ridiculous. In the Journal of the American Medical Association, August 28, 1981, it was published that it makes no sense to measure lymphocytes in the blood because only a few of them are in the blood. The immune system is carried out, not in the blood, but in the tissues. Only rarely and accidentally do we see some of them in the blood. We've already carried out thousands of studies which have proven no correlation between disease or health in older young, in T-cells, and even less, of course, in T-cell subsets. But even though they knew that these T-cell tests had not meaning, they were selling them to the market. Beginning in 1977, starting in the United States, it was possible to patent biological entities or biological techniques, so people started to make money out of biological ideas. This is the definite turning point when modern medicine and modern biology lost their unchild, their innocence. That's it. The immune surveillance theory of cancer, the belief that if you measure the strength of the immune system, then you could see when you are going to develop cancer, was the basis of AIDS. The thinking about AIDS. They said if your immune functions are weak, you are going to develop all viral forms of opportunistic infections and all forms of cancer, and this never happened. As a matter of fact, in AIDS we never have seen opportunistic infections. We have never seen all viral forms of cancer, only one form of cancer, Kaposi sarcoma. Zengers. When you say, in AIDS we have never seen any opportunistic infections, what do you mean by that? Because virtually everything associated with AIDS is considered an opportunistic infection. Dr. Lanka. That's not true. An opportunistic infection is a bacterial infection which takes over when the immune functions are down, when you have an immune defect or an immune deficiency. This was and is the definition of an immune defect and an immune deficiency. When bacterial infections are taking over in your body, generalized bacterial infections. This is the case in those children born with an immune defect, who have to live under a plastic tent, or those people in the intensive care units, patients dying now like flies, because they are having immune deficiency after an operation, accident, transfusion, or transplantation, when immune functions are artificially suppressed. Bacterial infections go everywhere in the body, and due to the resistance catastrophe, which is the medical background of why AIDS has been invented, definitely they are dying like flies. But all these internalized bacterial infections never have been part of the definition of AIDS. Zengers. I remember that was a question the AIDS experts got asked at some of the very early meetings, in the early 1980s. Well, if it's a breakdown of the immune system, why don't you get colds all the time? Why don't you get flus all the time? Why don't you get these common infectious diseases all the time? Why is it just these really esoteric things like PCP and Kansas and CMV and MAI and whatever? Dr. Lanka. That's it. The only diseases seen in people with AIDS are the ones tropical disease specialists have specialized in. Those are unicellular organisms which came into existence in evolutionary times, when there was not as much oxygen in the atmosphere as there is today. So they can only grow in people who are depleted of oxygen. And that's it. Why they show up there, even when the immune functions are absolutely perfect. Especially in the case of fungi, their immunology, their immunity is not known. They think they have the same immunity as bacterial cells. But evolutionary biology answers these questions as well. Fungi came into existence after animal beings. The fungi invented enzymes which are even able to produce energy out of oxidizing. They feed on dead organic matter, and that's their task in evolution.